Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Monday, July 27th, and this is my daily briefing. We've had 212 cumulative positive cases in Missoula County to date, with 13 new cases added over the weekend. 209 of those cases were identified by testing, and 3 were epi-linked, and we've had 154 recoveries and 1 death. 4 non-county residents are currently hospitalized in Missoula County, and we have 57 active COVID-19 cases with more than 240 close contacts. Active cases and their known contacts are in quarantine and isolation, and they will continue to be monitored and supported as needed. The state of Montana is reporting 3,381 cumulative COVID cases, which is up 41 cases from yesterday. There are now 1,244 active cases with 61 hospitalizations across the state. There have been 47 deaths related to COVID-19 statewide. 50 of Montana's 56 counties have reported cases either historically or currently, meaning that about 89% of Montana has been directly impacted by COVID-19. Undoubtedly, most of the state has been affected by the virus directly or indirectly, as its reach is far and wide, affecting everything from healthcare and well-being to health access, the public education system, public transportation systems, social services, and the economy, and more. I hope your work week is off to a good sunny start. It is going to be a hot one this week. Remember that while you're required to wear the cloth face coverings inside public settings and in outdoor public settings when 6 feet of space can't be maintained, you are reminded to carefully take the mask on and off as appropriate to make sure that you, the wearer, doesn't get overheated. Keep your face covering handy for when you need it, but take it off when you don't need it. Most of us only need the face covering for short periods of time, like when we're shopping at the grocery store, standing in the coffee line, or picking up takeout. Put that covering on and take it off as appropriate to better protect your friends, family, and community members. So today we're having a soft opening at our new county clinic out at the old Garden City warehouse on Flynn Lane. This morning we were accepting same-day appointments for testing at the new site this afternoon. We continue asking people that are currently experiencing COVID symptoms to call us at 258-INFO to speak with a public health nurse for a symptom screening and appointment slot as needed. The current complete list of COVID-19 symptoms includes fever or chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Emergency warning signs for COVID-19 might look and feel like trouble breathing, persistent pain or pressure in your chest, new confusion, inability to wake or to stay awake, or bluish lips or face. These are emergency warning signs, and if you or someone you are with starts experiencing these more intense acute symptoms, please seek emergency medical attention immediately. If you're a resident of Missoula County and you're experiencing symptoms, not the emergency symptoms, but just general COVID-19 symptoms, connect with us for a same-day or next-day appointment. Please remember that we have 2 different options when you call us at 258-INFO. Option number 1 connects you with our public health information line, where public and community health specialists are available Monday through Friday from 8 to 5 to answer those general questions about COVID-19 and our local response effort. Option number 2 is going to connect you with a public health nurse to discuss testing options both at our health department testing site and in the community. I want to remind everyone that Sentinel testing, or the strategic testing of people not experiencing symptoms that have been in those high-risk environments for COVID exposure and transmission, has been paused since late June, when information indicated that we needed to just put a hold on it to respond to the high demand for testing of people who are currently feeling sick and close contacts to active cases. We do continue to see a high demand for testing for those groups, those who are having symptoms and those that the health department notifies are close contacts to a known case. We are going to continue keeping an eye on the data, and we'll resume Sentinel testing if and when the data indicates that our healthcare hub can handle the expanded services. If you don't qualify for a test at our health department testing clinic for any reason, when you call 258-INFO, you'll be provided with a list of options of other clinics and providers in town that might also be able to meet your needs. We do have an integrated county-wide response effort, and that includes sharing the responsibility of testing community members efficiently and effectively for the health and safety of our community and to protect our healthcare hub. Distributing cases across providers and across time, as well as associated tasks like contact tracing and monitoring, are a few ways that we continue to ensure that we don't exceed our local capacity to manage COVID-19. So I hope everyone has a safe and healthy week. Make sure that you take time to cool off in the shade or the air conditioning. Maybe take a dip in the river. Make sure that you're continuing to practice those safe behaviors and masking up to continue protecting each other and to help keep our COVID-19 manageable. That's it for my daily briefing today. So as always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that little notification bell so you get notified when additional videos are uploaded. Follow us on Facebook at the Missoula City County Health Department's Facebook page. We do post a lot of information there. Check out our website at missoula.co/cvirus, and you can call 258-INFO if you'd like to schedule a test or if you just want some general information about COVID-19. So everybody stay healthy, and I will talk to you again tomorrow.